Hi everyone, welcome to my channel. Don't forget to like, comment, and subscribe. Inflation on drives long-term care costs even higher. Here's how planning ahead can help families afford it. Stan Horowitz and his family didn't have any plans regarding long-term care until there was a crisis. His father, Martin, was in his late 80s and lived alone. He was reluctant to accept any assistance from his children. One day, Stan and his sister found their dad unconscious in his living room after a fall. This incident 6 years ago set off a cascade of medical issues. Martin was never able to return home, and when it came to trying to sort out his father's finances, the bureaucracy was intense. Stan said. He said his father was diligent about putting money away, but the cost of nursing care wiped out his life saving $300,000 in 4 years. Martin, now 93, qualifies for Medicaid, which pays for his skilled nursing care. The Horwitz family's ordeal in paying for long-term care services is not unusual, and high inflation will likely make the rising costs more difficult for many families to afford this care. Inflation has now replaced staffing as a top concern of skilled nursing and senior housing facilities. According to a new survey, as small increases in essential operating expenses, food supplies and energy are making a big impact and aren't easy to cut. How much long-term care can cost? The average 65-year-old has a 70% chance of needing long-term care according to the US Department of Health and Human Services. Yet, 1 in 10 of middle-income adults ages 44 to 64 don't have long-term care insurance according to a survey by Arctos Foundation and HCG Secure, and many people are not aware that Medicare doesn't cover costs associated with long-term care services, which can include dressing and bathing. The cost can vary widely by type of care and location. On average, long-term care costs $50,000 a year at home and $100 in a nursing home according to LTCG, which provides services to the long-term care and life insurance industry. But in Connecticut, LTCG found nursing home can cost an average $165,000 a year, and in Texas just cover $70,000. Traditional long-term care policies are expensive. Few long-term care insurance policies have unlimited coverage. Costs vary widely and depend on age, gender, health, and other risk factors. For a new policy with $165,000 benefit, a healthy 55-year-old could pay $45,000 in premiums by the time they turn 88 according to the American Association for Long-Term Care Insurance. Tom Bierregaard was an executive in the health insurance industry when his parents were in their early 80s and dementia and pulmonary disease required them to have daily care. Understanding your options. That experience prompted him to start a company to help middle-income families understand their options. You need objective experts to help you understand how to make transition plans, how long you can keep people at home safely, what kind of services you can bring in. Bergert said, low-income adults may qualify for Medicaid, but that requires a look back which considers assets held in the last 5 years. Many others in middle to upper income demographic choose to self-fund long-term care, but experts say it may become more difficult for older adults to manage the rising costs of these services. There are insurance options to help offset the cost from traditional long-term care insurance to hybrid policies that combine life insurance and long-term care coverage. These policies provide funds that can be used to cover care expenses down the road, as well as a death benefit payable to the insured beneficiaries if care is needed, to say. Okay, that's all. Thanks for watching and see you for the next video. Bye bye.